Hello and welcome to Focus on Health. I'm Dean Leisgang. Today we are at the Aurora Medical Center in Oshkosh talking about back pain. Dr. Vishal Patel, a pain management specialist, joins us to shed some light on this very important topic. Dr. Patel, thank you so much for joining us today.
Of course, pleasure. Thanks for having me.
Yeah. What are the most common pain conditions that you see come through your office?
So we treat everything in our office from the head down to the toes. The most common areas that we see typically are the major joints in the body and the neck and the lower back overall. Patients can get these pains from a variety of different things, mostly getting strained to the lower back from an injury or work-related event. Some type of traumatic fall can cause them. It could be a chronic issue that aggravates in the short term, or it could be related to some type of other medical condition, whether it's a chronic inflammatory condition or it's related to cancer with metastatic lesions going to the spine.
So when should a patient actually go consult their healthcare provider, or who should they go to in particular?
Sure. So a majority of back pains will resolve on their own. So the good thing at first is to kind of wait it out, take some over-the-counter anti-inflammatories, stretching, strengthening, icing the area, and letting it relax. If things are persistent or the pain is very severe, the patient should see their primary doctor first. That's a good first step to diagnosing whether they need to see a specialist, whether that specialist is a pain management physician like myself, or seeing a spine surgeon.
You mentioned the diagnosing. Take a little more in depth on that, your approach to the diagnosing.
Sure. So before I step into that diagnosing itself, these patients, when they come in, the signs and symptoms that they typically see, some will have isolated pain that is in the back. Sometimes it will shoot down the legs as well. It could be a combination. It could be one or the other. There could be numbness, tingling, burning sensations that are involved with it. And the pain can be sharp, it could be dull, it could be aching. So it does vary from person to person. The biggest thing is looking out for red flag symptoms, and we'll go into that a little bit here as well. The last thing I kind of wanted to talk about there is the anatomy and what causes that pain.
Yeah, and you brought a prop to use.
Yeah, so this is a larger model here. We're going to isolate down the lower back here. So the neck works very similar to the lower back in that regard, so we'll focus on the lower back to highlight some of the major areas that can bother you. So these are your vertebrae here. This is your tailbone. And the little vertebrae meet at these little joints, and they are called facet joints. The yellow in here is our nerves, and you have your main spinal canal in the middle, and the nerves coming out, which are your nerve roots that go down your legs. And they give off little branches here that go and innervate these facet joints as well. On the front side of the spine, you have the discs, and most commonly people know about disc herniations or disc bulges. And those disc bulges can push back, and they can push on the main canal in the spine or on the nerves as they come out, and that presents in different ways. In addition, there is a ligament that sits in the back of the spine here, and that ligament can get enlarged and cause pressure on the spine. And in addition, these facet joints can get arthritis and inflame over time and enlarge, and enlarging of those joints can cause pressure on those. So those are the three more common areas that can cause pain. That's not saying that you can't get a fracture where people get compression fractures and the front side of this bone decreases down, or you can get fractures on the sides here, or you've had surgery in the back, which is causing the pain overall. But those are the main generators of the pain in the back overall.
Very complex. What are your treatment options available for the pain then?
So when a patient comes to see us in the office, we do a detailed history and a physical at first. After examining them, we will usually send for diagnostic imaging based on what they think is appropriate for them. That could be a combination of an X-ray, a CT scan, MRI, or EMG testing of the nerves. Based on a combination of all of those together, we'll decide about their treatment options. Those treatment options can include everything from medication management to physical therapy to alternative medications. We offer a lot of interventional options to go in there and really target down the pain. And then based on their presentation, they might need surgery, and there might be red flag symptoms like we mentioned that could be targeted down, and we would refer to a surgeon if need be as well. Now, I mentioned those red flag symptoms earlier, so I wanted to at least go into a few of them.
Sure.
So sudden onset of the pain are the biggest things there. So not just the pain, but if you have weakness in the legs that occurs out of the ordinary or out of the blue. A sudden injury or fall where these things present all of a sudden would require short-term workups, and usually you'd present to an emergency room for that workup. If you have sudden loss of your bowel or bladder function, if you have numbness or tingling in the groin area or between your legs, these are considerations that something is more suddenly going on. And then a patient's history also factors into this. So if they have a history of cancer or are actively being treated with cancer, have sudden weight loss, and are having back pain out of the blue, that would warrant more of an emergent workup. In addition, someone that's at a risk for bone fractures such as osteoporosis or had a recent fall needs to be worked up for whether a fracture is causing their short-term pain.
Important takeaway for our viewers is there are solutions available for this pain.
Correct. And diving a little deeper into what options that we offer for those treatments. So after we do work it up, like we mentioned, medication options, there are different classes that help with decreasing inflammation, oral steroid packs that can help for short-term pain, nerve pain medications, whether they're things like gabapentin or Lyrica, which a lot of patients have heard of, or atypical medications that they have not heard of. Muscle relaxation can be a component there, and we have some other medications, whether they're topical or oral, that can benefit in this regard. Pain medication does come into play for certain patients. We offer it at certain intervals or based on certain complexities of the pain, but we do try to stay away from those for a lot of our patients. Therapy does help with increasing range of motion, getting flexibility back. Alternative treatments such as chiropractic care, acupuncture, TENS units are all different modalities that we can make available to our patients here. And I mentioned interventional options, and I wanted to dive a little deeper into that.
Sure.
So for patients that are not surgical options, are not responding to more of our conservative options with medication and therapy, we would do interventions where we go in and try to decrease the swelling in the back or address the back pain overall. For our bread and butter injections, for pain that shoots down the leg, they call it sciatica or lumbar radicular pain. We go into the main spinal canal here, where the nerve is pinched. We can target it one way, one side or the other side, and inject a combination of numbing and steroid. That would decrease the swelling where the disc is bulging outwards and help reduce their shooting pain down their legs and the back pain overall. If it was an arthritic component, we could go after these joints that are located here, and there are nerves that sit in these grooves that only supply those joints. And that would involve testing of those joints, seeing if we can relieve the pain for the testing window. And if it is helpful, we come back and apply heat to that location. And that heating is called radiofrequency ablation. It's a mouthful, obviously, but it helps to decrease the sensation to that joint and can last for a much longer period if the testings are beneficial.
Certainly a topic we could spend a day talking about. There's so many layers to this.
Correct.
Thank you so much for providing this wealth of information. Very, very informative.
Thank you.
If you still have questions about this topic or would like more information, feel free to reach out to Dr. Patel or your primary care provider at 920-303-8700. Thank you so much for joining us today. I'm Dean Leisgang, and we'll see you next time on Focus on Health.